Now, we're done talking about the signs and symptoms of respiratory distress syndrome. So right now, we want to go into the complications of respiratory distress syndrome. Now, you should be able to differentiate between the signs and symptoms and complications of a disease condition. Because complications of a disease condition is more of like, this disease condition was not treated to the extent that it now reached the advanced, the stage where everything was now, disorganized and all. So complications of respiratory distress syndrome. So this is respiratory distress syndrome, which even if you don't understand anything, you should just understand that there's like accumulation of fluid in the lungs, and this is where normally your air should be able to accumulate so that you can breathe properly. So fluid is now taking up the space for air. So particularly in neonates and adults that are so ill, it can lead to a lot of complications, right? So one of the complications is hypoxemia. So oxygen levels in blood and tissue supply is very low. So this can lead to organ dysfunction. So important organs like the brain, like the kidneys, like the heart. So pulmonary complications. So it can lead to what? Pulmonary edema, that's accumulation of fluid in the lungs. Pulmonary fibrosis. So it could lead to lung damage of tissues of the lungs. Then barotrauma. High pressure ventilation can cause pneumothorax or air leaks. Infections. So as you are having respiratory distress syndrome, they have to actually come in to help you breathe. So sometimes they use all those ventilators. So those ventilators can have some 1 or 2 infections that you can pick up. Then some of those infections can get into your bloodstream, resulting into sepsis. So heart issues could lead to hypotension and shock, right heart strain. Then issues on the kidneys, issues on the liver. The neurodevelopmental delays. So in children that happen to have this, the way they develop will not be as sharp as their counterparts. Then they have respiratory issues for a very long time. So that's it for complications of RDS.